Mariam Villa, we are on. Thanks so much for coming on, taking some time for today. I know I just got home like 15 minutes ago. Sure you're busy running around too and everything. What's going on? How you doing today? Thanks for coming on. No, thank you. Thank you. Wait, I can only see part of you on the camera here. I think it's a little bit lower. Still a little bit low. That's better. That's better. There we go. Okay, that works. That works. So what's going on? How was your day? Actually, it was a long one. Another 12 and a half hour day. Just another long day. First day back from a week off. I had my girlfriend's sister and wedding over the weekend last week. And so it's just my first day back, and it was a long day. But hey, so why don't we break this down? Because I really want listeners to get a chance to kind of know you through this recording and your outstanding journey and what you're currently doing on a daily basis. Between being a mother, you're in dental school, and you have a kid that's, I mean, I can't imagine. You came from another country. So we've talked a bunch. I know all these things, but let's just try to trace back to the beginning. So, which country were you born in? Let's start there, and then we'll trace the journey. Grew up in Germany. Okay, got it, got it. So, Moroccan parents grew up in Germany. And when did you move to the United States, and why? In Germany. Okay, well, that's good news. So, since then, 7 years ago. How old is your son now? Oh, great. Yeah, yeah. So about 1 year old, you got him over here, and then he began treatment, and everything. And how's everything since then? Well, that's some great news right there. And is it okay if we kind of go into your age and the timeline a little bit? I don't want to, if that's okay. Yeah. So did you study anything in Germany, just so kind of people can piece together the transition here? Did you study in Germany? Did you go to university? Did you go to dental school? When? Where? Yeah, really, really. Great. Really? Wow. Where'd you go to undergrad, real quick? Yes. West Florida. So you were first in Florida, because I know you're not there now. Don't go into that yet, but yeah, we'll get there. We'll get there. That's right. That's right. Did you do any studies when you were in North Carolina, or was that strictly just for on the Army base? Okay. Okay. So it was initially on the base in Arizona, and then now dental school. Are they helping take care of some of the finances of dental school, I hope? What's the NHSC? Just a lot of viewers, I want to give them as much information and, in your story. So you're moving kind of around the bases, and you're in the Army, Navy, you're in which, right? But you were initially in the Army when you started in Germany. Was it the German Army, or was that in Germany? Interesting. As a German citizen, you were able to be part of the American Army. Oh, gotcha. Oh, okay. Okay. Now that's making more sense. Are you still together with your spouse? No. No. Yes, yes. And when you kind of, I don't want to pry too much, but just to kind of, the full story. When were you separated in Florida? Was that North Carolina or Arizona? And then when did you meet your new partner? Oh, so soon as you said goodbye, you turned around and said, "Who's this hunk over here, huh? Who's this hunk in the Navy?" They all work out the way they're supposed to be. So now, tell me, you were a single mom for a while, still kind of, in that, but raising your son. Thank goodness you found a partner who's supportive, who's able to take off some things on your plate. That's just, I mean, I don't know how you'd be able to do all of that alone, single mom, just you, in dental school. I mean, I don't see that being possible. And I get a lot of comments. I just got one today. I got one today about how just last week I put up the post, where someone had asked me on my question of the day, my question of the month, and someone was like, "With your salary that you make in residency, is it possible to raise a family?" And I'm like, "Absolutely not. But wait, it is possible if your spouse is not in dentistry, or if they are, you need to get family involved and this and that." And actually, just a comment on it today was a woman saying that, "Hey, 25 years ago, I was in dental school and I was able to raise a family and everything." And congrats. Yeah. No, no, yeah, no, it's great. Come on. And you earned all this. Don't you forget that. Yeah. That's right. Thank you. And anything I can do to help, because your journey's only just beginning. There's so much more to come. Yeah, and you were such an inspiration for me as well. I mean, I can't imagine this girl doing different countries, different continents, different career paths, going for, a single mom raising a child who has a disability that needs some attention, whatever level that attention is, and every kid needs attention, right? But it's a different kind of attention, and you needed to be able to recognize that, get the diagnosis, get the treatment, and you're on the right path with your family as well now. I mean, that's just incredible, and I can't thank you for coming on and just sharing these things. So now that's where we are right now. Oh, another question I wanted: how many languages can you speak? Right, German, English, Arabic, and French. So Arabic because your parents are from Morocco. Is that right? Where did French come from? Tell me about French then. Oh wow. So English was your fourth language you learned. Wow. And what about your son? Right. So you're saying nonverbal, but is he going to know multiple languages too? Going to stick with just one? Very nice. You're going to go with your partner as well as your son? Oh, that's going to be fun. Oh, that's going to be a fun time. How long do you get to stay there? 1 week, 2 weeks, a month? Yeah, that's great. So your family's back there. Good, good, good. Where's your partner from? Mississippi. Yeah, Atlanta is pretty far south too. Enjoy. Excellent. So what about the rest of your journey with dental school? Do you think you're interested in any specialties? I know it's early. You're just finishing up first year. What do you think you want to do? Specialties? You were mentioning that through the Army, you'd be able to work in some of those healthcare centers that could serve underrepresented communities. Can you also kind of get into whatever niche you want to, whether it's oral surgery, cosmetic dentistry, endodontics, pediatric dentistry, maybe, since you're kind of, you said behavioral therapy once upon a time, right? You have some experience being that your son has autism, right? Would you ever do kids? Would you work with disability? I'm just curious what you're thinking. Yeah. Yeah. I love that. I love it. And I'm so glad that we met. And now I just found out that you know multiple languages. One of my goals is so I work very hard on learning Spanish and Spanish, especially in the dental setting, to try and connect and communicate and explain certain things, whether it's treatment, risk, benefits, alternatives with patients and such. In addition, I have, my girlfriend's Spanish. Um, but basically, one of the goals I have long term that I think would really apply to your vision here is maybe creating like a course one day where we can allow dentists that maybe they end up moving into a community that they didn't recognize. They have a very German speaking or Arabic speaking community, and they want to be able to just basic level explain some things. And we could offer a course where it's like intro level, beginner, then I don't know, like advanced and expert. And then expert would hopefully be that they can fully speak a language fluently in addition to medical and dentistry in that language. It's something for the future. And then also tying in your understanding with kids and patients with disabilities. I mean, this could be a multifaceted course here that I think would be tremendous, especially we have such a diverse population in different parts of the United States. So it's something I see coming to the future, and it sounds like your vision and dream kind of coincides with that a little bit. That's right. I do too. I do too. So what's the next step? Just a couple. Anything that you wanted to touch on? I had just a few more questions. I want to make sure we could get everything in. Sure, sure, sure. And after I graduate, we'll be able to talk more about other things. All in all, I mean, just very, very basic level is that I always like the idea of there's like some quote out there somewhere. It's like you should always strive to leave the room better than when you walked in. Whether it's like cleaning up a little water that dropped on the floor, or it's I don't know. We could think of so many scenarios, but I don't know. I came into dentistry. It is such a beautiful profession. It really is. But I'm seeing more and more issues that have a pretty negative domino effect for the future and in the future to come. In fact, during our lifetime, our careers, our career is going to be roughly 30 or so years, right? Give or take. It's a very physical profession, so it's not like a remote job where you just open up a laptop and sign in at 9 a.m. You're face to face with people every day. So you need to be, number one, you need to be able to communicate and connect with people and patients, right? So that's that. But understanding that our profession is actually, we have a very finite amount of time in our lifetime, right? Medicine gets better, surgery gets better, healthcare gets better over time, technology and whatnot. But our bodies are much slower to adapt than I think we give them credit for. And I don't know. What I'm saying is, dentistry is awesome. That's why I came into this profession. But as we go, there's been a lot of changes, even just within the about 8 years I've been in it now. And if these changes continue, it's already not what it was 10 years ago. But if these changes continue this direction, and they're only getting they're changing exponentially. By the time that our 30-year career could be, I don't know, it's a very different direction. And I don't know, I see. I guess I'm a problem solver. I see a lot of fires, and I'm a firefighter. You try to put it out, right? But there's some really. The issue is that I don't see the direction getting any better until we talk about it. We discussed the student debt it's literally like a triple or like a double-ended sword. It's literally a hole where there are three shovels digging into it, right? The debt coming out of, students coming out of school, the lack of reimbursement, that insurance, they're not increasing even with inflation, and then it's lack of patient care too. So the people that come to see you to get help can't even get the help because whether they can't afford it or you can't offer that service or they're so sick and tired of going from this specialist to that specialist to this specialist. I don't know. It could be one thing or another, but it's like these are some very surface level problems that we need to address. We need to start talking about them. I don't have the answers, but I hope that connecting with people like you, we can get those answers, get them to the surface, and actually make a change for the years to come. Whatever we're going through now, whether it's something personal or dentistry on the day to day, I'd hope that by talking about it, we can make the future something better. And that's what I mean by let's leave the room a little bit better than when we walked in. We're all going to come to an end one day. Hopefully, we leave something behind that's in a bright light, on a positive note. That's all. Yes. Mhm. That's right. That's right. And I know that you come in with that attitude too. It's all about the attitude, the ambition, and you're in a great place now. So I'm excited to follow you on your journey through this. We're gonna keep in touch. Yeah, yeah. We're gonna have a part two in the future. Okay. So whether it be next year, whether it be 2 years, I don't know, but let's just kind of keep tabs on where it is. And I make a little note, like I had a note tonight for our talk, and we postponed from 2 weeks ago because conflicts. But yeah, I mean I rapid fired how many questions at you. So I set a little note, and then over time, as questions come up from listeners, viewers, myself, our conversations on the side, it grows, and I hit everything I wanted to tonight. But no, this is great. This is exciting, and I can't thank you enough for coming on and kind of expressing your experience and your journey. Oh no, thank you, and we'll make it brighter together. All right, man. We'll talk soon. Okay. All right. Good night.
Yeah. Hey, good. How are you? Thank you for having me. This is awesome. Yeah. Now, is it better? My day's good, dental school, kiddo, yeah, life in its fullest capacity. Yeah. Just got out of Gross Anatomy Lab and here in the library. So, yeah. How was your day? Nice. Yeah. Yes. Yeah. Okay. It already starts interesting here. So, I was born in Germany, but to Moroccan parents. So, my parents immigrated from Morocco to Germany, but I was born there. Just we moved around a lot, lived in France for a bit, in the UK, in Morocco, but for the most part, I grew up in Germany. Yeah. hmm Yep. I moved about almost 7 years ago now. So my son has autism. That was really a big factor. I was also a military spouse at the time. So the military brought us to the US. But a big thing for my son was we really couldn't figure out what was going on with him. The resources weren't there as much. And really, just to get him diagnosed and treatment was really, yes, it was actually something that they couldn't figure out what was going on because he was really passing all the diagnostic testing. And basically, we moved to the US and seen several specialists, went from doctor to doctor, and ultimately were able to get a diagnosis for him. And thought out treatment. It was a little bit of a trickier case, but ultimately we were able to got the diagnosis and get him in all these therapies and treatment. Yeah. Yes, absolutely. He's 8. Yep, he's 8 years old. Yeah, the time flies. Everything is going really great. I mean, has been a journey. He went from being completely nonverbal with high behaviors to the extent of like me not being able to leave the room to now being able to attend school, be able to socialize in the environment. We went from being able not leaving the house to now being able to be part of our community. So it has been a huge journey. Yeah, absolutely. Absolutely. I'm an open book, Brandon. Yes, absolutely. Yeah. So basically, the way my journey kind of happened is I'm a little bit of a non-traditional here. I went into academia. Wanted to become a teacher. Had my son. Focused on having my family. And an opportunity came up at the military base that basically trained military dependents on the military base to become dental assistants. And I was like, why not? Right? Like, if we're gonna get stationed in in the U.S., why not have an additional skill set? So I basically went through this program and really recognized that as dentists, we're not just fixing a tooth, right? We're teachers, we're in a way counselors, we're engineers, we're solving problems on a daily basis, right? We're artists. And there are so many different nuances that really I was so intrigued with that I started looking into dentistry, and I recognized I can be a teacher in that sense. And yeah, so that's kind of how my dental path came along. Moving forward, we moved to the States. My son got diagnosed, and that made me really look into how does the dental field look like in terms of providing services, providing treatment for patients with special needs. So during undergrad, I became a behavioral therapist and really wanted. I went to undergrad at the University of West Florida. Yep, we got stationed at, yeah. Yes, so I moved from Germany to Florida, attended college there. Meanwhile, got my license as a behavioral therapist and worked with different groups out there, nonprofits, and yeah, really enjoyed it. Has really opened my eyes in terms of like how can we bridge those access to care barriers, really, from a dental standpoint. And then moved to North Carolina, worked some more years, and now I'm here in Arizona, where I'm in dental school at Midwestern. Yes, so in North Carolina, I was specifically working as a behavioral therapist with children with autism. So that's really was my main focus while I was out there. And really looking into the different dental schools, really trying to see, okay, where do I want to end up? And yeah, this is how it really brought me out here. But yeah, there's a huge military base in Fort Bragg in Fayetteville. So this is what initially brought me out there. Yes, yeah. So I'm actually on the NHSC scholarship, so the one that is the community service based one. So yeah, absolutely. Yeah, absolutely. So it's the National Health Service Corps. Basically, it is a really for us to have a commitment to the community. They basically cover your tuition in full, give you a monthly stipend, and when you graduate, you get to work at a federal health service center and provide services to the underserved in our community. Some of them in rural areas. It is a really great way to serve your community while also practicing dentistry. And like I said, the tuition is completely paid for during your time in dental school, so it alleviates that burden. Absolutely. And you get to pick where you want to apply, like for any other job, really. You just have to look at those. There is a website connector where you really look into the areas that are in need. Yeah, and this is how you get to choose where you go. So it was the Army that we were part of. Yes, yes. It was the American Army actually. Like yeah, my spouse was in the Army, so that's what got us to come out here originally. So we moved with the military out here to Eglin Air Force Base, and then yeah, Fort Bragg in North Carolina. So yeah, I mean, I was a spouse, so basically I married a service member who was in the military. So and then I became a citizen later on when I moved here to the States. Yeah. No, I'm actually a single mom. I'm raising my son. I have a loving partner. So that's also was part of our journey. The military lifestyle was actually it was quite a hard one, but I found a very loving partner, and I honestly don't even know without him going through dental school how that would be. But yeah, this is kind of how life turned out. Yeah, yeah. So basically, it was in North Carolina, and my current partner he was actually in the Navy, so also military affiliated. And yes, he was stationed out there. You're funny. Yeah, he was actually about to get out. He was stationed out there, and I met him right before I actually moved to North Carolina, not too long after. So it was very interesting to say the least. But you know how things sometimes turn out, I guess. Yeah, exactly. Absolutely. Yeah. Absolutely. Yeah. Yes, absolutely. So I'm a first year here at Midwestern. Started last summer. I have 4 weeks left. It's like I said, it's wild how time flies. Thanks, thanks. Yeah, I mean, when it comes to money and resources and support, it's I mean, like you hit the nail on the head. Like it is not where we were 20 years ago, right? So things just change rapidly. And I would lie if I would say it's easy. It's really not. And it is helpful having a partner who has an additional income. Plus, having that scholarship is really helping with some of that stipend money. But it's really about being, I mean, I'm not living in a huge house and I'm living very moderately. but it is doable, but it takes really budgeting. It takes I can't buy just I go out and buy a new car, right? Like I have to literally live humble and just make sure that I am living within my means. So I think that sometimes people have that misconception that, hey, you're already living like a dentist, and that's absolutely not the case. I'm sure you get it all the time as a resident. So I think that there's a huge misconception. And when it comes to support, I would say leaning onto people. I think that's something that I get asked all the time. No one knows how you feel because they're not really going through your journey, right? They're not walking your path. But if you don't lean onto the people around you, how will you ever get help? So that's an epiphany that really just came with time. And that's something that really that I would like just to point out. That's the biggest thing that has helped me. My classmates in dental school like have supported me tremendously, right? Um like I said, my partner now, my friends, family, just having that support system is really key. And I would say that has been really the biggest source of support when it comes to that. Yeah, I would say that's really the biggest thing. And also thinking about it takes humility to ask for help, at the end of the day. Like I shared with you prior, when I was pregnant in Germany, I was homeless actually, and I was taken in by family. And I think during that time it came to show that, you know we are all the situation that you're in life at times, you're not defined by that, right? And it's a shift in mindset that you need to put yourself through. If I think about this, like I said, 8 years ago I was pregnant and homeless, and now I'm becoming a doctor, right? Talk about imposter syndrome a little bit here, but I just, yeah, and I think it's just shifting your mindset. That's all I'm trying to say, like really recognizing the things you're going through in life, you're not defined by that. So lean onto the people, seek your support system. We all going through stuff. I might not exactly know what you're going through, but look at us. We're friends. We met over social media. And you have been such a huge asset in my journey. So yeah, no, thank you for everything. Yeah, thank you. Yeah. How many languages? Um, yes. Arabic and French. Yeah, yes. Yep. So yeah, that I get that asked all the time. So Morocco actually used to be a colony of France. So that's kind of like our second slash first language. So it's almost like we have two first languages in a way. But I grew up with both, and my mom used to be a translator, so we spoke at home French and Arabic. So that's kind of where it came. And then in school I learned German and later on English. But yeah, 10 years ago now. Yeah. Yes. I mean, actually, he was nonverbal. He's using an AAC device right now to communicate. Basically, it's like an iPad, and you hit buttons, and it helps you speak. So, he was nonverbal for the longest. Now with the aid, he has help to speak, and yeah. So that's kind of where we're at. But we're working. It's a journey, right? So exposing him to as much as we can, right? The brain is a sponge. So that's kind of what I'm saying. We're actually going to Germany in a couple of weeks for break. So we'll see. Yeah, yeah, yeah. First time. Yeah, it's gonna be really fun. I'm excited. I haven't been in a year so far, but I'm really excited to see my family. Give some of that exposure to my son and my partner. Yeah. I wish again money, right? 2 weeks. 2 weeks. We're staying 2 weeks during break, and mhm, yeah, he is from the South, from Mississippi, actually. Yep, he's from the South. You would not be able to tell with his. He doesn't really have a Southern accent, to be honest. He's originally from Atlanta, so maybe I don't know. Maybe that's why, but that's where he's from. Yeah, I was about to say it's very South too, but yeah, not really. He always tells me the military, having that exposure to different people from around the U.S. Just has helped him, I guess, tweak that a little bit, maybe. But yeah, yeah. Yeah. Yes. Yes. Yeah. Yes, absolutely leaving the doors open, right? But I was looking into Pete's for a while, just because also that special needs component. I would love in the future, that's kind of my dream, to have a dental office that is tailored, I like to say, to all people with all abilities. I oftentimes think it's not, it's not the provider's fault to not know how to serve a patient with special needs. I like to say it's like, if people don't have the tools in their toolbox, how they're supposed to know how to provide a service, right? So it is my ultimate goal to go around, educate people, and have a dental home, an extension for them to really feel like safe and have a journey within a dentist that's, hey, I get where you're at. I've been there, right? So that's why part of me was looking into peds, for that special needs component, and I've worked with kids for many years, and I really enjoy it. I always like to say, by heart, I'm an inner kid myself. So yeah, that's kind of what I was looking into. But obviously, like, leaving the doors open. I'm fresh in my journey, maybe one fourth almost. But yeah, just leaving the opportunities out there. Yeah. Yeah. Absolutely, Brandon. And like I said, even though we connected over social media, what you do for us as dental students and for all of us really out there, raising awareness, educating people. This is really goes hand in hand with what my beliefs are, and I'm really excited about us working together and seeing where our future goes. But yes, I absolutely agree with you. Really building a platform that empowers people, right? That give them the tools to be successful and to ultimately be an asset to other people. So I see great things for us coming along the way. No, I mean, I think my biggest thing is like, and I asked you that, right? Um, and this was something when I found your platform, I was really curious. What got you actually into the educating piece of things, right? People always see social media and it's fun and right, but they don't recognize it's a lot of work. First of all, you're very, very busy, right? As we know. What got you into it? I think that side people don't know. Yes. Yeah. The one thing I thought of, being a catalyst for change, right? You're seeing there is an issue. You see that is this something that needs to be addressed? It is affecting all of us. And at the end of the day, it takes one person, it takes a village, right? I like to say we're ultimately one village, and we all have something unique to give. We have all something unique to bring to the table. So again, creating this platform is ultimately going to allow all of us to go through this journey with certain tools, right? So we don't know how that's going to look like in the future, but leaving the room better than where we found it. I like that a lot. Yes. Yeah, for sure. Thank you, Brandon. Yes, absolutely. I'm excited to see where this is going. Do you have anything for me? I'm open book, so yeah. Thank you, Brandon. Thank you for what you do, for our little community and helping us out. Yes. Talk soon, Brandon. Thank you. Bye.